into pain management. So I go to this place. It's a little sketchy, and they were normally used to doing a block, but they would do it for like shoulder nerve pain or something like that. He goes, yeah, we can do this. It's not really a problem. So I went and I had my consult with him, and he said that he was going to stick steroids in there. And I'm like, that doesn't sound like it's the same thing.
So I'm actually pain management. The reason why I'm here is because I'm very well versed at doing the procedure, obviously.
Right.
Really, only people that do the procedure are pain management doctors, because they do it for that shoulder thing that you talked about.
Sure.
Now, when you do it for the specific condition called complex regional pain syndrome, usually you do use a steroid when you do it, because there's a pain component, and that kind of helps with more of the pain aspect of it as well. With this, if it's more anxiety or PTSD based, you usually don't. Unless for whatever crazy reason there's an overlap where a patient will have that as well, then you can do both. But really, you don't need to. And you kind of hit on that, set up the way that we are, where we're doing it specifically for patients with anxiety, PTSD, some other conditions as well. So we know the nuances in terms of what we're actually treating, and we're actually doing checklists and different scores and criteria. We have the two different physicians, myself and Dr. Lucas, who are there, which nobody else really has, two doctors that you're working with. I think especially for patients that do have PTSD, there's a comfort in having someone who's anesthesia trained be there to monitor your vital signs and make sure that you're doing okay in terms of your body during the procedure too. So there's quite a few differences that I think our group provides than others.
I had to pay for a flight, I had to pay for a hotel, I had to pay for the procedure, and to me it was still worth taking that chance than to do it with somebody who doesn't really seem like they understand what they're doing. I do think that might be something that needs to be put out there more, that just because your insurance or just because somebody says that they do this procedure doesn't mean that you're getting the same quality or the same actual procedure.